Welcome to Charter Local Edition. My name is Brad Pomerance, and we are coming to you from Washington, D.C. We are joined by Dan Benishek. He is a member of the United States Congress representing the state of Michigan, also a medical doctor, a surgeon. And so I want to speak with you, sir, specifically about the Affordable Care Act. How is the act rolling out in Michigan and your district most generally?
Well, I've been opposed to the act from the beginning because as a physician, I realize that we have a great healthcare system in this country. The problem is it's too expensive. And the president's healthcare bill doesn't do anything to fix that part of it.
And let's talk about that, because it is a very interesting point, the question of cost containment. We've been very focused on ensuring the uninsured, and that may be a laudable goal, but if the costs continue to rise at the rate you know more than I do, it's still problematic, no?
It's very problematic. Not only is the cost going up for the average person, the reimbursement to our local hospitals and other providers is going down. So the availability of actual health care is diminishing. So if you have insurance and nowhere to go, that's a problem. I've been trying to educate the public really about the dangers of the Affordable Care Act, and people are learning it now because it's affecting their pocketbook. People who have insurance are getting huge rise in premiums. They haven't been able to find insurance. And our local hospitals are feeling the bite. They're laying people off, and in some cases closing.
And as I understand it, for those states that accepted the expansion of Medicaid, that may be nice on the one hand, but a lot of doctors are not accepting Medicaid anymore because, as you suggested, the reimbursement's too low.
Well, having insurance is one thing, having access to care is another. And I don't think the president's bill increases access to care. As you said, with the low reimbursement, hospitals are closing, providers are not providing the care. They have employees as well, so it's definitely problematic.
I want to talk about one element of our healthcare system, and that is serving our veterans. I know that you chair the Veterans Committee on Health. I believe you worked at the VA for a time before you were a member of Congress. Talk to us about that.
Well, my district, veterans are a big part of it.
Right.
There's 15% veteran population.
Wow.
I'm not a veteran. My daughter's a veteran.
Your daughter is?
Yeah, she was in the Navy. I worked at a VA hospital for 20 years as a consultant and surgeon. And I understand that bureaucracy. So I've been able to serve here in the House on the VA committee where I can have a little bit of insight into how that bureaucracy works. We're trying to make it more efficient. These big government agencies are difficult to change. So having a little bit of insight into how they work helps me make them better.
And so is efficiency improving? I mean, we've heard the stories about long lines, both literal and metaphorical, for our veterans trying to get
I think they can do a lot better, frankly. One of the things I'm working on is accountability. When you talk to the Veterans Administration, it's hard to find the actual individual who's responsible for getting something done and then holding that person accountable.
Right.
So we're trying to make that more translucent so that we can see who's responsible for what.
What about our veterans who may be suffering from PTSD, mental health challenges when they come home, our newest veterans, of course?
That's a major problem that we're facing. We're trying to be able to get them faster access to care, more consistent care, be able to see the same doctor. It's an issue that we are struggling to fix. Hey, I'm happy to be part of the committee and working hard to make that happen.
I hope so, because I know our veterans are really some of our most valued and prized.
Well, not only the recent veterans, but veterans from the Vietnam War, from past wars. We really need to work hard to make that happen.
I want to thank you so much for joining us. He is Dr. Dan Benishek. He is a member of the U.S. Congress from the great state of Michigan. I'm Brad Pomerance. This is Charter Local Edition.